Hi everybody, my name is Tanya Friedman and I'm the Chief Operating Officer of Kinetics. I'd like to welcome you today and I wanted to give you a few pointers and tips for your interview. We're excited to meet with you. We can't wait to meet with you. We know that you are excited and maybe a little bit nervous at this time. So I wanted to just give you some information to help you to prepare. You might want to get a pen and paper, have that handy as I'm going through a few pointers and tips. So the first thing for you to know is, as a recruitment company, we specialize in direct hire, and we handpick the clients that we work with. So what we look for in a client is someone who is going to have excellent working conditions, really good rate comparative to the cost of living in the area. We look for an employer who's going to be welcoming, who's going to give you very good training and orientation, and also who's looking to build a community. Because I know, as I was an immigrant myself, I came to this country many years ago, how hard it is to make that transition. I know it's your American dream, but it is hard to make that transition. So where we have an employer who's going to give you that, what we call a soft landing, where there is a community of other nurses who come from similar backgrounds or similar home countries to you and can help roll out the welcome mat for you and help you to acclimatize when you arrive. Those are the kinds of things that we look for. Of course, as many of you know, Kinetics are certified by the CGFNS for ethical recruitment practices. So we look for an employer who's going to pay you the same as an American nurse, equivalent to an American nurse with equivalent years of experience and education. So right now, I know that you are preparing for the interview, and there are a few things that I'd like you to know. The first thing is that the nurse managers that are going to be interviewing you are going to be, they're not there to try and trick you in any way. They're really going to be asking questions to try and get to know you a little better. You can expect that when you come for the interview, you will be in the interview for about 30 minutes with the nurse manager. It will be, in most cases, one-on-one. The nurse managers are very experienced. They have interviewed international nurses before, so they will have a set of questions, but you'll find them very warm, friendly, and they're very, very welcoming at this particular hospital. We work with many hospitals, and I can tell you, this hospital, the staff are very, very warm and very welcoming. And really, they just want to get to know you a little better. A few things that you might want to do beforehand. So first of all, it's very important to research both the hospital and the location. I would suggest that you write down on a piece of paper before you go to the interview 3 things that you have found out in your research about the hospital and 3 things about the location, because you want to make sure that they know that you've done your homework, that you're not just wanting to get a green card, you want to work for them, and you've done your homework about the hospital and about the area. So it might be that you know, you've looked on a map, you have researched the population of. Another part of the research that you might want to do is our Kinetics team will have sent you some questions, which are basic behavioral-based questions. Things like, and behavioral-based questions is really where you're looking at behavior. How does past behavior predict future behavior? So for instance, they will ask you questions like, can you give me an example, a specific example from your past of where you've used your initiative? Can you give me a specific example from your past of how you've handled a difficult patient or a difficult physician? Can you tell me a specific time in the past when you have had a successful teamwork relationship? So they're really looking at your past behavior to see a specific example in the past that can help predict future. And that is where we don't know exactly what questions they're going to ask on the behavioral based side. So a good way to get around that is to write down, again on a piece of paper before the interview. Make sure that you give some thought to it so that you don't go into the interview and afterwards walk out and say, oh, I should have said that, I could have said that. So make sure you take time before to write down on a piece of paper and write down, I would say, probably 5 examples of where you have excelled as a nurse, where you shine, or times of where you have showed your successes.